Little Johnny went to skiing practice. He was having a good time when boom, he flips and falls. He had his knee bent at a 90-degree angle and hit the anterior side, pushing it posteriorly. The trainer performs and comes out. She first does an anterior drawer test, pulling the knee forward. Then does a posterior drawer test, pushing the knee backwards. Then she does a valgus test and a varus test, checking the MCL and the LCL. Some signs and symptoms for her knee right now, for little Johnny's knee, is swelling, bruising, knee feeling weak, pain when walking, posterior drawer test being positive, and having a limp while he's walking. The trainer decides that little Johnny's going to go to the doctor.
You're going to the emergency room.
No!
Little Johnny gets to the doctor. They do an MRI. He comes back. The doctor comes in and says, "Little Johnny, you have a posterior cruciate ligament tear, the PCL. After your surgery, you will have 9 to 12 months of rehab." Immediate plan that we would have before his surgery is the special test, sending him to the doctor, working on quads and hamstring stretch until surgery, resting, ice, compression, and elevation. After little Johnny gets back from surgery, during week 1 through 3, he'll be wearing a brace and having 2 crutches. They'll be working on hamstring and quad stretching and strengthening, bending the knee, range of motion. They can do towel pulls. They'll be working on range of motion. They want to prevent sagging of the posterior side of the knee, leg raises, moving the patella around, ankle pumps, hamstring and calf stretches, standing, and also you want to give them a little bit of stim. The goals of weeks 1 through 3 is good control of the quads and hamstrings, range of motion, and normalizing the gait. Weeks 4 through 12 is the brace can be unlocked for some activities, then increasingly unlocking the brace for all activities. You want to start giving weight bearing. Little Johnny will be able to start wall slides, leg press, doing standing 4-way hip exercises, a little bit of bike for 10 to 15 minutes, balancing, proprioception, seated calf raises. The goals for 4 to 12 is increasing the range of motion, mobilizing the gait, and strengthening of the quads and hamstrings. Month 3 through 9. Little Johnny will be able to will be starting to not use any crutches. You want him to be doing the treadmill, but walking only. You can have him do some swimming, squats, jumping squats, a little more activities. The goals for 3 to 9 months is gain all of your range of motion back, improve kinetic chain exercises, maintaining strength and flexibility of the quads and hamstrings. Month 9 through release of play. At this point, little Johnny will be able to only have the brace while working out. And you want to start using exercises that are going to go towards their sport. For little Johnny, you want to start with using the sliding board, where he can slide back and forth with his knee, jumping sideways and frontwards and back, squat jumps, shuffling with the bands around his knee, lunges, running and skiing around some cones and some small slopes. The goals for this is safely returning to physical activity.